We need to be healthy as healthcare workers and registered nurses so that we can care for our patients, not be a vector, spreading this virus.
Here in New Jersey, the number of COVID patients in ICUs and needing ventilators has doubled since Christmas to levels not seen since May of 2020. And not just here, but across the country, hospitals are struggling to care for COVID patients.
A new record in the pandemic. 141,000 Americans are now hospitalized with COVID, with more than 1,500 deaths reported each day. That number up more than 34% in the last week. New Jersey Governor Phil Murphy calling the Omicron surge a, quote, tsunami marching across the state.
Both the ICU and ventilator numbers are up significantly and have roughly doubled since Christmas. These are the highest numbers we've seen since May of 2020.
Some hospitals at their tipping point. 1 in 4 hospitals across the country is now reporting a critical staffing shortage. In Virginia, Governor Ralph Northam issuing an emergency order to expand hospital capacity and increase staffing at hospitals and nursing homes. In California, COVID-positive healthcare workers are now allowed to return to work if they are asymptomatic, a departure from CDC recommendations.
If we have a nurse that calls out, what that means for us is we can't open a zone in the emergency department.
Healthcare workers across the state are concerned. This as the CDC is reportedly considering updating its mask guidance, according to the Washington Post, to advise people they should opt for N95 or KN95 masks rather than cloth masks.
A man in Maryland is living his 4th day with a pig heart beating in his chest after a groundbreaking surgery.
You good?
Surgeons at the University of Maryland transplanted the pig heart into 57-year-old David Bennett in a last-ditch effort to save his life.
He's awake, he is recovering and speaking to his caregivers, and we hope that the recovery that he is having now will continue.
During the 9-hour operation, doctors replaced Bennett's heart with one from a 240-pound pig, which was genetically modified for this purpose. According to his family, Bennett is aware there's no guarantee the experiment will work, but he agreed to the procedure because he's ineligible for a human heart transplant.
For him, it provided a level of hope. My dad's only 57 years old, so that was very important to him, and he didn't feel like he was ready to die.
It's not the first time this type of procedure has taken place. The new procedures mark a major step in the decades-long quest to use animals as organ donors.
It is a game changer because we'll have these organs available and, can customize the heart or the organ for the patient.